In this lesson, we're really going to focus on the important points of shock. Before we get started, the thing you really need to know are that there are lessons on each one of these types of shock that we're going to cover today. So we really just want to hit the high points. But the most important thing that you need to understand about shock is that shock is a result of inadequate perfusion to tissues and organs. What happens is you have this decrease in oxygen and this decrease of blood flow, and there's always a primary cause for it. So what you need to do is focus on fixing the primary cause. It's often characterized by this low blood pressure. And your job as a nurse is you need to recognize symptoms of shock and you need to intervene early. So let's go over a couple of symptoms, right? So you can have low blood pressure, you can have an increased heart rate, you can have decreased urine output, UOP, that's what that stands for. You can have high or low temperatures for patients. They can have cool or clammy skin. And they can also have a change in mentation, like they could be confused or they could be disoriented, any one of those things, or even a change in consciousness. So pay attention to these signs because they could be pointing you to early signs of shock. Again, it's this decreased oxygen, decreased blood flow. We got to try to figure out what's wrong with them. We're going to hit on 4 types of shock today. So you've got hypovolemic, cardiogenic, you got neurogenic, and you've got septic. So let's get going. Now remember that there are lessons that go much more into depth than what we're going to cover today, but I really just want to hit the high points. So make sure you check those lessons out. When we're dealing with hypovolemic shock, let's break it down. You got hypovolemic, so you got decreased volume. So that's what hypovolemic shock is. So basically you have decreased volume so bad that you're actually having decreased oxygen and decreased blood to those tissues and organs, and you're actually causing some tissue damage. So you're going to see this in terms of trauma, injury, surgery. So like gunshot wounds, stab wounds, or if they're bleeding after surgery, the blood isn't staying where it's supposed to. So the overall volume decreases and they get low blood pressure, heart can't keep up, and tissues are affected. So the best way to actually do this is to treat the volume loss. So you're going to do this through like IV fluids, or blood transfusions, right? But the thing is, you have to find the cause of the hypovolemia so you can stop the bleeding and then you can treat the volume. So now let's take a look at cardiogenic shock. Now, if we remember, the heart is a pump, right? And in cardiogenic shock, the pump is broken and it can't get the fluid out to where it needs to. So if the pump is broken, you have decreased blood flow, which means you have decreased oxygen and decreased nutrition or nutrients via the blood system, right? So it's not, if the pump's broken, it's not going to deliver that stuff. And what happens is the tissue is damaged, the blood vessels begin not to respond, blood pressure drops. So that's where you'll get that hypotension. And what this does is this actually creates another problem in itself. So the blood pressure is dropping, and so now the blood can't get back to the heart. Heart can't pump, so blood pressure drops. So you end up getting some, the heart tissue itself is not getting enough blood supply, and you actually get some damage to the heart itself. So one of the most common causes are heart attack or heart failure. And so what we have to do in order to fix this is we have to increase the contractility or the squeeze. So we have to increase that squeeze in the heart, because we want to try to increase the pump so that every time this pumps out, we're actually getting more blood flow so that we can try to correct this blood pressure and get it up. So if your patients have a heart attack and you correct the heart attack, then you can improve the perfusion of the heart and then in turn fix the cardiogenic shock. But what you want to do in the meantime is you want to support this blood pressure and you would try to increase this squeeze. So now let's take a look at neurogenic shock. Neurogenic shock is a little bit more complicated because we have to understand a little bit better. So if we go back, we remember we have we'll call it the central nervous system. The central nervous system it supplies a signal to the body, right? So let's say it's sending a signal to the heart. Well, it also sends, we'll call these blood vessels, right? Here and here. So the central nervous system tells the heart and the blood vessels to constrict and relaxed and the heart to beat a certain way. And with neurogenic shock, there's an injury here. This becomes injured. So now this signal is disrupted. This signal is disrupted. So when that happens, you have this thing called loss of tone. So the signal is what we're talking about. It's called sympathetic tone. You have a decrease in sympathetic tone. And this is caused by like trauma or surgical problems or injury, but it's an injury to the nervous system. And when that happens, you'll get this relaxation because you have no more sympathetic tone. What happens? Blood pressure drops, heart rate can drop. But what you're doing is you are going to want to support this blood pressure. You want to manage the pressure. You also want to allow some time for healing. Remember, we're dealing with the central nervous system, so this is not something that's just going to automatically heal. So we have to give it some time, really support the blood pressure and do supportive therapy, manage the blood pressure, make sure you're getting the oxygen in the blood and the nutrients to all the tissues that are affected. Now, I'm sure you have all heard of septic shock or sepsis, and we're really going to focus on that sepsis is a response, the body's response to an infection in a very, very dramatic and bad way. Basically, you get this really bad inflammatory response and everything goes haywire. And when it does, you're going to get this decreased blood because you have all these inflammatory things happening. You get this decrease in blood pressure and you get this relaxation of all the vessels, and you get decreased blood and decreased oxygen, and it affects the tissues. So what do we need to do for those patients? Number one, manage your pressure. Again, focus on managing that low blood pressure so that we can get these two things to go up. And also, and more importantly, treat the infection. We get that infection under control, we can, a lot of these things will start to get better on their own. But the problem is you really got to manage this pressure and you got to treat this infection. And it's going to take time. This is not something that's just going to be like, oh, hey, this is going to happen right now. So we got to give it some time. So you're going to be offering that supportive therapy for those patients. For today, we really focused our nursing concepts on perfusion and oxygenation because that's really what shock is about. And we're also we do this by supporting our patients through patient-centered care and by managing those pressures and the infection or whatever their primary cause is. So let's recap. Hypovolemic shock is about volume. We need to find the volume loss and fix it. Cardiogenic shock, we need to focus on fixing that broken pump and then increasing the contractility and then increasing that blood pressure. Neurogenic shock, remember that the central nervous system or the spinal cord or whatever part of that system is not working and you lost that tone. So you got to support the blood pressure and allow time for the nervous system to heal. Septic shock focuses on the infection. If you have an inflammatory response, so treat the infection, support the blood pressure. And most importantly, shock is the result of not getting the oxygen in the blood to all the tissues because you have low blood pressure. So if you find the cause and support your patient's blood pressure, you're going to get that oxygen and the blood all to the necessary tissues. So that's it for our lesson on shock. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.